Dr. Alex Earle here, and it's Hump Day with Dr. Alex Earle. And of course, it's time you get to spend with me, and we're going to go over several plastic surgery topics, okay? And today, I wanted to go over, of course, something that we do very, very commonly. It's actually the #1 procedure in the US right now. Do you guys know that? It has now beat breast augmentation. So for years and years and years, the #1 procedure or cosmetic or aesthetic procedure in the US was breast augmentation. And this year, or I guess I should be more accurate, the last survey, which was from last year, 2022, now the #1 procedure in the US is liposuction, whether it's combined with or without fat transfer, but liposuction is now numero uno, and breast aug is numero dos, all right? But so today, I wanted to talk about liposuction because it can get a little bit confusing out there. So, some patients are like, well, what's liposuction? What's liposculpture? What's lipo 360? What does that include? I don't get it. I don't understand. And then you have all these add-ons, like what's the laser, the J-plasma, etc. So it does get a little bit confusing. And so today I just want to go over a lot of those terms to try to explain what they are so you can understand exactly what it is that you want, okay? And so we're just going to go over all of that, and then we're going to end up talking once again about the total definer package, which of course includes lipo and many, many, many other things. Actually, it includes everything. Pretty much everything you could think of is included in that package, okay? But, all right, so liposuction. So liposuction, as you know, of course, is when we use a cannula, which is a long device that's attached to suction. We put it underneath the skin, and we suck out the fat. That's like, pretty much the simplest definition of liposuction. And it started many, many, many years ago. I think one of the first persons that started doing liposuction was actually a gynecologist. Yeah, if you could believe that. They used some of the same instruments they used to do their DNCs. And then they decided like, hey, wouldn't it be cool we sucked out some fat? And that's how it all started. And of course, it's caught on like wildfire. So that is what liposuction is. Let me tell you right now what liposuction is not. Liposuction is not a form of weight loss. Okay? So liposuction is not for losing weight. Liposuction is for changing shape. Okay? So think of it that way. So don't think of it as something for weight loss. Think of something as molding the body, changing the shape of the body by reducing fat, especially in those stubborn areas that are very, very difficult to reduce on your own, even with diet and exercise alone. Okay? So it's really about molding the body. It's about changing the shape. Okay? And that's why today in 2023, nobody really does like straight liposuction anymore, right? If you have, like a square shape and you just did some straight liposuction, you just go from a bigger square to a smaller square, right? That doesn't really help anybody. That you could have done with diet and exercise alone, okay? But what you can't do with diet and exercise alone is going from a squarish body to now an hourglass shape of beautiful curvy body, okay? And that's where the liposuction comes in. We often get those comments, and I think they're, I just find them funny today, but really asinine comments about like, oh, she should have gone to the gym for that, right? And it's typically some guy, saying that, and that's just ridiculous because the gym, like I said, can maybe reduce the amount of fat that you have, but it's not going to alter the underlying shape of the body because you can't target it, right? You can't say like, you can't like work out and do a diet exercise and be like, just reduce the fat at my waist, right? It doesn't work that way. So then you just go from a bigger square to a smaller square, but you're still a square, right? And most people, that's really what they want to change. But liposuction is, of course, what allows you to do that. So, like I always say, the best combination is all three: surgery, diet, and exercise. Okay? So, in today's world, we're talking about liposculpture. That's what we're doing. We're not just doing straight liposuction. We're doing liposculpture, o en español, lipoescultura. That's what we're doing right here. And your standard liposculpture is what we call liposculpture 360, or some people just abbreviate to lipo 360. So when someone says lipo 360, they mean liposculpture, and 360 means the entire trunk. What's your trunk? I'm not talking about the trunk in your car. I'm talking about your trunk, okay? So the trunk is all this. So the abdomen, so from here down, okay? The flanks, all along here, and of course your back. When we talk about the back, it's about 90% of the back. So it's from above the brow line, so let me point it out, from here down. So from here down, okay? That's what it includes. That's what's Lipo 360. That's the most common term right now. Some people back in the day called it Lipo 12 areas. But no one really uses that term anymore. But just in case you hear it, when they say 12 areas, they mean Lipo 360. They mean the entire trunk. Okay? So that's what's included in your liposculpture, and it's not just about reducing the fat, but it's about shaping the body. So a lot of times we're really focusing on the waist, and we want to shrink the waist more than anything else so that we can go from a straight shape to a nice, beautiful hourglass shape, okay? So in the skinny patients, say for example, where you can't shrink the waist that much, really the only way to then create more curves is to perhaps leave a little bit more fat up top and then add fat to the hips so that way then we can create more of that curvy shape, okay? All right, so that's what liposculpture means. And now we're going to get into some of the other terminologies, okay? So the next one that you may hear out there is either ab etching or HD lipo. HD stands for high definition, okay? So when we talk about ab etching, that's typically we're just etching out the abdominal muscles. When you talk about HD lipo, that's a little bit more intense. Now we're not only defining the abdominal muscles or the rectus muscles here in the center, but we're also defining the obliques. So really, we're really defining the entire abdomen to get that really kind of athletic look, okay? And then typically when you talk about ab etching or HD lipo, we are talking about the front, and we're talking mostly about the abdomen, and you're really getting that, that athletic look that we said, okay? And that's usually what it refers to. There are degrees to this, okay? You can have what some people call a soft etch, or soft, and that means that you have that athletic look, but it's still very, very feminine. It's not, it's not like the six-pack or anything like that. It's kind of like a soft, athletic look, and you can go from there all the way to like the ultra or extreme athletic look, where you're really etching out all the muscles, every single pack, all the six-pack, and making it look more extreme in that sense. The extreme HDs is more common with men, and with women it's more of that soft edge. That's more common with women there, okay? Well, the one thing I didn't mention, I'm sure at the top, but of course liposuction is not just for the ladies out there, right? It's for guys too. So guys can benefit a lot from liposculpture, and especially that HD look. There's a lot of men out there that, they're doing the diet, they're killing themselves at the gym, and there's going to be areas where they just can't define it. It's very hard to define genetically or for whatever other reason, and that's where that HD lipo is going to come in, because you can reduce just that little bit of amount of fat you need to reduce in those areas to really etch out those lines, to really give some definition to all the muscles, all the muscles that you've been killing yourself at the gym to build. Okay, so once again, for men, again, the best combination is lipo, diet, and exercise. Okay, all right, so that's what HD lipo stands for. So the next thing that you may hear about is something called a vaser, okay? And this is a vaser with a V, okay? Vaser with a V is an additional machine that uses ultrasound energy, okay? The technical term is to emulsify the fat. What does that mean? It basically shakes the fat off and it loosens up the fat so that it's easier to come out, so that when you use the vaser, you can extract more fat. You can do it in a way with less blood loss, less inflammation, and because it is also imparting some heat there underneath the skin, it improves skin retraction. It's a great, great machine. I've been using it now for a few months. I love it. It's been giving some really excellent results. So I would recommend this pretty much for all liposuction cases, that you add on the vaser. Okay, again, we're going to be able to extract more fat. We're going to do it in a way that it's less bloody, with less bruising and inflammation, and better skin retraction. And like, who doesn't want that, right? So great, great machine there. The one thing you gotta know that this is different from the laser, okay? Because there is a laser lipo, or some people refer to it as smart lipo, okay? And that one is pretty extreme. I've seen some bad cases of that. I've seen burns. I've seen excessive fibrosis. Going back to they're doing a secondary case after the laser with the Earle lipo is very, very difficult, very, very challenging. So while I highly recommend the vaser lipo, I do not recommend the laser lipos. I know that can be very confusing, but they're completely different machines and they work completely differently. Okay? So just remember, laser with a V. Okay? All right. Okay, so we have the laser, we got the HD lipo, the lipo sculpture. Now, well, what can we do other than the laser? What are some other things we can do for the skin, which can be done at the time of the liposuction? So one is the body type, and a lot of people have heard of a similar one called J plasma. Okay, they both use a similar energy, which is called RF, or radio frequency energy. So RF, radio frequency energy, and that's what the J plasma does, and that's what the body type does. Okay. And this you do at the time of your liposuction. So basically you do your lipo first, and then you can add this to help the skin retract. If we're talking about the order of things when we do liposuction, the first thing that we do is we put in some fluid called tumescent fluid. Then if you're using the vaser, the next step would be the vaser. Then you do your lipo sculpture or HD lipo. And then the last step would be your J plasma or body type. Okay, which is going to help with the skin tightening at the end. And this uses a wand that also goes kind of underneath the skin. The body type I like because it's kind of like a sandwich action. It has a wand underneath the skin, one on top, and it heats the skin from inside and from the outside. Okay, it brings up the temperature from the inside and the outside, and that creates an inflammatory response, which then allows the skin to retract better. Okay, and that's what the body type does. And we can even add to that what's called Morpheus 8, which is now microneedling with RF energy. So both of these have RF energy. All right. And the Morpheus 8 is the microneedling that goes on top of the skin as well to help that even more. All right. So sometimes you can combine all of these modalities to really get some pretty significant skin retraction without having to do a cutting surgery like a tummy tuck. Okay? But only for the right candidates. If you have a lot of excess skin, you got muscle separation, you got abdominal weakness, you've had 3 or 3 pregnancies, or you have massive weight loss, skin is just hanging, none of this is going to work. You're going to need that tummy tuck. Okay? That's why it's best to get an evaluation. You get an evaluation, we take a look at the skin, how much excess skin. Also, there's a need to repair the muscles, and therefore we can decide what's the best approach. But like I've always said, if you need a tummy tuck, it's always best to do your tummy tuck first. Do your tummy tuck first, and then come back 3 to 4 months later for your liposculpture or your BBL. Okay? All right, excellent. And then, of course, so we talked about Lipo 360, and then you can add on other areas. I think one of them I forgot here was your chest for the guys. But we can add on your chin, we can add on arms, we can do axilla, thighs, chest, and what I sometimes call the upper back or the buffalo hump, which is all the way up here. Okay? Not everyone needs that. It's actually kind of rare. Most people don't need that. That's why it's not included in your Lipo 360. But if you do have excess fat in that area, a lot of people don't like it because it literally looks like a little hump there, like a little hunchback. And so we can reduce that with liposuction as well. Okay? All right, so I think that pretty much explains a lot of the terminology out there. But the one thing I haven't gone over just yet is then what we call the pure total definer package. All right? So the pure total definer package, now that you've understood all this, now you can understand the package because the package includes everything. Okay, so in one package, you can get your liposculpture 360 with your HD lipo, with your vaser, with your body type, with your Morpheus, and if you wanted to, all the areas. All of that in one package. Plus, potentially for the fat transfer. So for the women, fat transfer to the buttock and hips, and for the men, fat transfer to the different muscles they want to augment. For example, your chest, your triceps, your biceps, your deltoids. Okay, we can do that. We can actually, firm up and give more volume to those muscles. So it's a great surgery for both men and women. But guys, don't sleep on this. All right. Say you've been going to the gym, you've been killing yourself, like not eating, you're doing 3 hours in the gym every day, and there's just areas you just can't define. I mean, you're the perfect candidate for this. We can define all those areas. You get that chiseled look. All right, we can augment whatever muscles are not getting the volume that you need. We can do it all in one surgery, which will take maybe, I don't know, 3 to 5 hours, depending on how much we got to do. All right, so I highly, highly recommend it. But the great thing of the package is that it includes all of this, but not only that, we're going to take care of you. It's going to include your post-op care. It's going to include your hotel stay. It includes the cell saver. It includes your cosmetic. It includes pretty much everything that you need. Okay, so basically we take care of you completely from pre-op to the operating room to post-op. Okay, all right. I think that pretty much hopefully makes it clear for you. But of course, if you have any questions about this or anything else, I'm happy to answer.
Yeah, we have a lot of questions, Doug.
All right, I love it.
This one, for example. Hi, I will be in Miami on the 22nd of this month. Would it be possible to get a consultation with you, Doc?
Oh, I would love to do it, but that is Thanksgiving week, and I'm not going to be here, unfortunately. All right, I'm going to be with my family in Puerto Rico. But yeah, I would highly encourage you to give us a call to see if something can be worked out. As all you know, our phone number is 305-230-4326. Or you can also start the process online. You go to our website, www.pureplasticsurgery.com, and hit the little button that says virtual consultation.
Doug, can you say from an online consultation if I need a tummy tuck or BBL?
Yeah, so many times we can tell, even with an online or virtual type consultation. Sometimes if I feel like I need a little bit more information, and you're far away, we can do a video consult as well. But that's why it's so important to accurately fill out that questionnaire and send all the necessary photos. So at the very least, we need 3 photos, which would be like a straight front view, straight side view, straight the other side. Of course, if we're doing something to the back, for example, BBL, then we need the 4th photo, which would be your entire back. But if we get all the photos, we get your questionnaire, then yes, we can make those determinations and see what's the best approach for you.
The important point, which one doesn't cause fibrosis?
Which one doesn't cause fibrosis? Okay, unfortunately, with any liposuction procedure, there is a risk for fibrosis. Okay, but I'll tell you which one. The one that causes the most fibrosis, and that's the one I do not recommend, is the laser or the smart lipo. Okay, laser or smart lipo, that's the one that causes the most fibrosis and the most scar tissue. And I've seen the most burn with those as well, so I don't recommend that. With any liposuction procedure, there's a possibility for fibrosis, and the post-op care becomes incredibly important. Okay, that's where your massages and your compression come in. So part of the issue of fibrosis, it depends on how compliant the patient is. So you're going to have to do a minimum of 20 massages post-op. Some patients require more. Okay, and of course you have to wear your compression adequately. One mistake that I see is patients that compress too much too early. Okay, if you're like in the first week and you're like already in your stage 2 faja and compressing too much, that's actually bad. It's detrimental because we need that skin to be able to get adequate blood flow, all right, and for the whole area to get adequate blood flow to prevent scar tissue. The other thing that helps prevent scar tissue is your hydration. You need to be drinking 1 gallon a day, which is quite a lot. Okay, but the better hydrated you are, the better the blood flow, the least the chances of fibrosis as well. So keep that in mind, okay? One thing with the laser, you also have to be careful with the settings, okay? So I use settings that are not too high because I want to use that fat for fat transfer, okay? So I use the settings that are just high enough to emulsify the fat, but that it keeps all the fat cells intact. Right? You don't want to go to someone who doesn't have a lot of experience, is really cranking up that laser, If you crank it up too high, then you can get into problems with like burns and scar tissue as well.
Doc, the $1,000,000 questions.
Uh-huh.
Do you do a tummy tuck and a BBL together, or what should be done first?
Yes, so thank you for that. We get that question quite often. And my answer is they should not be done together. So I do not combine the tummy tuck and the BBL. I think that's the wrong thing to do, okay? Because you're gonna have an extremely tough recovery. You're not gonna get the best outcome from each of those. You're gonna compromise your results, okay? And it's just, think of it as a long-term investment, okay? Don't think of it as a day trade, right? Think of it as a long-term investment. You want the best long-term results that are gonna last, okay? So when you combine the tummy tuck and the BBL, there's gonna be some limitations. Number one, on how much fat we can remove, because here in the state of Florida, you're now limited to only removing 1,000 cc's. For most patients, that's not enough fat to remove and not enough fat to transfer for an adequate result. So you're already compromising your BBL results and your liposuction results, okay? Next, how are you gonna recover, right? Well, you did a tummy tuck, you can't be on your belly, so you're gonna have to be on your back. So there's gonna be some amount, even if you get a special mattress or special chair, there's gonna be some degree of pressure to the hips and the buttock. So once again, you're compromising your BBL result, okay? If you try to, and then think about blood loss. Now you're combining two major surgeries. Blood loss is gonna be higher, chances of them being anemic or requiring blood transfusions are higher, chances of blood clots are higher, so complication risks go up, right? So for all those reasons, I do not recommend the tummy tuck and the BBL at the same time. And if you're talking about the order of it, you should always do your tummy tuck first, and then come back 3 to 4 months later and do your BBL.
Why can you do the whole definer package or a BBL with a breast lift or breast augmentation?
Why can't you?
Why can't?
Yeah. So somewhat for the same reasons that I said right now. So if you're doing the breast, again, recovery's tough. You can't be on your breast, right? So once again, you got to be on your back. That's going to compromise some of the fat transfer results. We have that limitation with how much fat we can remove also when you do the breast, and now you're limited to only removal of 1,000 cc's. So not really enough for your liposuction, not really enough for your transfer. So once again, you're going to be compromising your results. So, total definer, it's best to not combine it with any other major surgery like a full tummy tuck or a breast surgery, unless you're someone like you're already like pretty thin, and it's really all about that definition. In which case, where maybe you don't need to remove a lot more than 1,000 cc's. So for those special cases, sometimes we can do it, but that's going to require an evaluation. So that's why I think it's always best to go to our website, www.pureplasticsurgery.com, go to that virtual consultation button, send in all your information so we can do an adequate evaluation, determine what's going to be the best procedure for you.
If a client wants a dramatic BBL, will you honor it or just do what you think is recommend?
So I do get this question, and I get it actually a lot less often today than I did, say, 5 years ago. So 5 years ago, the more dramatic BBLs, and some people call it vixen looks, were in. And today they're kind of not as in anymore. So now people are looking a lot more for kind of those beautifully kind of enhanced natural looks. And that's really what I do most of the time. Now, if someone does come in and they want more of a dramatic look, I can certainly try to do what the patient wants. But there's a couple things that I'm not going to compromise, right? I'm not going to compromise your safety. So that means that I'm not going to be placing fat into or deep to the muscle, right? That's the wrong thing to do. That's how patients die, basically. Okay, so we're not going to be able to do that. And so it's really going to depend a lot on your anatomy. So I can only shrink the waist. I can only shrink the fat between the skin and the muscle. Once I get to that muscle there in the waist area, I can't shrink that waist anymore. And I can only put fat in that safe space, which is between the skin and the muscle of the buttock and hip area. Okay, but once we fill up that space and that skin gets really tight, I can't really fill that up anymore. Okay, so that depends on how quickly and how quickly your skin will get tight in that area. Okay, so in order to get those really dramatic looks, a lot of patients are going to require more than one round.
How far after a C-section can I get a tummy tuck?
So probably the soonest we would do it would be 6 months after your C-section, okay? So we want to wait at least 6 months, and then you can go ahead and get that tummy tuck.
Okay. If I'm coming from another state, do
Yeah.
you guys know of places to stay for care after surgery?
Yes, stay at the AC Hotel, all right? So we do have stay packages here, so we can make your life very, very easy, right? We can basically organize your stay. We can organize your post-op care. We can organize your massages while you're here. So all those things we can actually, we want to make sure that it's as easy for you and as pain-free for you as possible, okay? So yes, we know of places to stay. Now, in order to do, to stay at the AC Hotel, which is our partner hotel here, of course you would have to bring a caregiver, right? So you have to let us know like who's coming with you and who's gonna be taking care of you. If you're gonna be coming like completely on your own, then you're gonna need something like a nurse, and we can make some recommendations there, or a recovery home. We're not affiliated with any recovery homes, unfortunately, at this time. So that, we may be able to point you in the right direction, but you'll have to do your own research in terms of a recovery home.
How long after surgery should you wear the faja?
All right, so for this surgery, so we're talking about liposculpture, you're going to be wearing the faja for the first 6 weeks, night and day. You're pretty much going to be using it 23 hours a day, taking it off just to shower. And then after that, between week 6 and week 12, you're going to use it 12 hours a day, okay? And then you can stop. Usually after about 3 months after surgery, you can stop with the compression and with the faja, although there are some patients that like to use it just a little bit longer.
Okay, how do I get started with a consultation being out of state? I'm ready to get my payment plan. I'm a mom of 3 wanting Lipo 360 and a slim BBL.
All right, great, awesome. So the first thing you want to do, or the easiest way to do it, is to go to the website, okay? Let's see, we can write it down here maybe. So www.pureplasticsurgery.com. Okay? So the easiest way to get started is to go to the website, and then you're going to see a button there, a link that says virtual consultation. You're going to hit on that, and then the next thing you're going to see is a questionnaire. Go ahead and fill out the questionnaire. Make sure you fill it out completely. Make sure you fill out every single tab, okay? And then it's going to ask you for photos. We're going to need 3 photos, and it's going to be of the areas of concern. So typically, for most patients, it's going to be the front, and then the side, and then the side. And of course, if we're talking about Lipo 360 or BBL, where we need to look at your back, then you add the 4th photo, which is the back photo, okay? That's going to come to one of our coordinators, and then I'm going to go over that information, and the coordinator then is going to reach out to you, okay? And then she's going to take it from there. You're going to answer all your questions. She can offer whatever options we have for financing and everything else, okay?
One more?
Yeah?
Yeah.
All right.
Do you use local anesthesia for lipo?
So I don't, okay? I do all of my liposuction cases under general anesthesia, okay? And there's a few reasons for that, okay? Number one, I think when you do it under local, you have to use a medication called lidocaine, which is what provides the numbing, right? So in order to be able to do that, you gotta numb the patient up. You're gonna be using lidocaine, and the body can only tolerate so much lidocaine before it becomes toxic. So there's such a thing called lidocaine toxicity. So if you put in too much lidocaine, that can affect the heart. It can lead to dysrhythmias and heart attacks, or it can affect the nervous system. All right? So you have to be very careful with that. And if you come to the limit and the patient's still feeling pain, then you just have to stop the surgery, right? So that's the next thing. I think the result is not as good. The surgeon can't be as aggressive, because the patient is going to be uncomfortable, they're going to be squirming, they're going to be moving around, they're going to be, yelling or crying in pain at sometimes. So I really don't recommend that. So in order for better safety for the patient and also for better results and a more comfortable experience, I recommend doing these large liposuction procedures under general anesthesia. All right. Okay, everybody. So that's it. But before we go, we have a few reminders, don't we? Okay.
Yes.
So I know everyone's been wondering, like, what is Pure gonna do for Black Friday? Are they doing anything for Black Friday? So we are, and we're gonna start announcing that here tomorrow. So I'm not gonna tell you what it is, but stay tuned. Coming out tomorrow, we're gonna have some special gifts for you regarding Black Friday. And then I want all of you who may or may not have signed up, remember that our Booty and Bubbles event is going to be tomorrow. We're super excited about that. We're going to be talking about the booty makeover. And we're going to be talking about a belly and Morpheus and Sculptra as well. So that's going to be great. All right. And then last but not least, we have a very kind of cool, special little promotion going on with Dr. Wieger. How would you like to come to Miami and have a free vacation on us? Huh? Does that sound good?
Oh yeah.
Who doesn't want to do that? You're up there in the north, you're getting cold, you're getting snow, right? Why not come to Miami for a weekend to hang out on the beaches before your surgery? So, and best of all, we pay for your hotel stay. All right? So, free weekend in Miami on us. That's the promotion for Dr. Wieger. Details of that will be coming out soon as well. Okay? All right, everybody. Well, I hope now you understand all the terminology. Now you're going to be armed with all this knowledge. I look forward to seeing all of you next week on Hump Day with Dr. Alex Earle. Ciao.
Okay.
Oh.